Assalamu alaikum. Today's video is about heat therapy. So we will start from the definition of heat therapy, then we will discuss what are the types of heat therapy, categories of heat therapy, when and how it should be applied, indications and contraindications. So starting from the definition, what is heat therapy? Heat therapy is also called thermotherapy, and it is the use of heat in therapy for pain relief and for health. It can be taken in various forms, like in the form of hot cloth, in the form of hot water bottle, ultrasound, in the form of heating pad, packs, whirlpool baths, cordless FIR, heat therapy wraps, and many other forms. Local heat therapy has been used for decades to relieve muscular pain and to relieve joint pain also, including arthritis, including back pain and dysmenorrhea. It may reduce pain by changing the pain nerve fiber conduction speeds and by raising the nerve pain thresholds. There are three types of heat therapy: local, regional, and whole body. Local heat therapy is when heat is applied from sterile probes to a small area or a local area. When it is applied to a limb or organ, it is regional heat therapy. A limb or organ is heated during regional therapy. And when it is applied to whole body, it's known as whole body heat therapy. Warm blankets, hot wax, or thermal chambers are applied in whole body therapy, heat therapy. There are two categories of heat therapy: dry and moist. Dry heat therapy is like dry heat sources draw moisture out of your skin. So there is one upside and there is one downside of this treatment. The upside is that it's very convenient and it's easy to use, but the downside of using dry heat therapy is that it could potentially dehydrate your skin. So if you have some kind of skin issues, it might be best to stick with the moist heat therapy, as you would not want to risk dehydrating your skin. Then coming towards the moist heat therapy. Moist heat is also called superficial heat, and it's a physical therapy modalities used to control the pain, and it helps to for speed healing and relax the muscles and increase the range of motion. In this moist heat treatment, a hot pack is placed on the tight muscles area and it's left for about 10 to 15 minutes. So this was moist heat therapy and dry heat therapy. Moist heat therapy has many advantages than as compared to dry heat therapy, so it's best for use. Then coming towards many questions about heat therapy. The first question is, why do we use heat in physiotherapy? Heat therapy works by dilating the blood vessels, and by dilation it increases the blood flow. So whenever the blood flow is increased, it helps to deliver the nutrients and oxygen to the cells in the area being treated, and it helps to facilitate the removal of the cell waste products, and by this it promotes healing. So this is how it helps in physiotherapy by healing. The next question is about what is the goal of heat therapy. So the heat therapy works by improving circulation and blood flow to a particular area due to increased temperature. And when the temperature is increased of the afflicted area, even slightly, it can soothe the discomfort and it increases the muscle flexibility. Heat therapy can relax and can soothe muscles, and it can heal the damaged tissues, as we have discussed in the previous slide that how it can heal the damaged tissues. So the main goals of heat therapy are uh, it can increase the muscle flexibility and it can relax and soothe the muscles that are tight and that are stiff. The next question is about, can heat therapy be used after injuries? No, heat therapy cannot be used directly after injuries because of the swelling. Heat is often best for the tight muscles, for sore muscles, for stiffness, and for pain associated with arthritis. Heat can also be used in acute injury to increase the blood flow once the swelling has been subsided. Remember though that applying heat too soon after an acute injury can increase the swelling. So once the swelling is subsided, therapy can be used, but it can not be directly used after the injuries. The next question is, can heat make an injury worse? Yes, if it is used directly after any injury. So heat will make the swelling and pain worse, which is not what you want. You should you also should not apply heat if your body is already hot. For example, if you are sweating, it won't be effective. So one of the benefits of heat therapy is that you can apply it for longer time than you can use ice. You cannot use ice for longer time. You can use heat therapy for longer time. The next question is, when do you start heat therapy after an injury? You can use heat therapy after 2 to 3 days of injury or after 72 hours, because in that time period swelling should have been peaked and you can begin to use heat, but not on all the injuries. Like for the aches related to bones and joints, ice is still a good treatment option. Heat is most beneficial with soft tissues and with your back. So it can be used for the soft tissues whenever the soft tissue injuries happen, or whenever the soft tissue injuries are related, so heat therapy can be used. The next question is, what is the risk of heat therapy? So heat is basically increasing temperature, so too high a temperature can burn the skin. Be aware of the heat therapy on an infection, as it could increase the risk of infection spreading. So don't use the heat therapy on a single local area for more than 20 minutes at a time. If you experience swelling, stop heat therapy immediately. Then comes who should not use the heat therapy and who has greater risk of complications from the heat therapy. So, for an acute injury such as muscle sprains, strains, knees injuries, fractures, dislocations, heat therapy is not advised. Ice therapy is advised. So, similar to cold therapy, heat therapy should also never be applied to open wounds and the patients with circulatory problems. So, who should not use heat therapy? With the people with open wounds, the patients with circulatory problems, and with muscle sprains, strains, and knee injuries and fractures, dislocations. Who has the greater risk of complications from the heat application? Those are at the greater risk for heat related illness, including the infants and children up to 4 years of age, and then the people 65 years of age and older, and people who are overweight, and the people who have certain kind of on certain kind of medications and who are ill. So these are at the greater risk of complications from the heat application. At the last, we'll discuss what are the contraindications. The patients with the peripheral vascular diseases and bleeding disorders, they are contraindicated. The people with local malignancy and acute inflammation and trauma or edema, infections or open wounds and over large scars, these all are contraindicated. Heat therapy should not be applied to the people with infection or open wounds and with large scars and with edema, inflammation, trauma, and with the impaired sensations like neuropathy, and who cannot communicate with you, or cognitive the patients with cognitive impairments like dementia or dysphasia. So this was all about the heat therapy. We have discussed the definition, what is heat therapy, thermotherapy, what are types and what are categories, where and when it should be applied, and a lot of questions, contraindications and indications. So this was all about heat therapy. For more informative lectures about physiotherapy, stay tuned to our channel, and do subscribe our YouTube channel. Thank you.